Plantar warts are a really painful condition. Many people will call them a callus, or sometimes I've heard my patients call them a bunion on the bottom of their foot. But a plantar wart is a viral infection that is implanted in the skin, and it goes through the dermal and epidermal layer and becomes very, very painful. Sometimes the lesions tend to spread. You may get multiple lesions in one foot. You may get multiple lesions on bilateral feet. So the longer you let this condition go, the more involved and more devastating it can be because of how difficult it is to treat, especially when you have multiple lesions that are present. Using the over-the-counter medications are sometimes successful with single isolated lesions, but for the most part, they're not really going to do the trick for you because they don't teach you how to properly care for this type of condition. Just putting on medication is not going to make something go away. When you have a plantar wart, usually if it's painful, it has to be excised because of the fact that it's become so deep. And just putting some over-the-counter topical medication is not going to alleviate or resolve that condition. But again, going to the podiatrist, letting them determine the level of thickness of the wart, where it's located, how many lesions you have, will determine how they're going to treat it, whether they're going to use prescription topical medication, whether they're going to use liquid nitrogen or what we call cryotherapy, whether we're going to laser them out, or whether we're going to just excise them. I think going to the podiatrist and having them looked at, determined, evaluated, diagnosed will give you the best outcome for your foot pain related to warts.